Okay, thank you so much for joining us. And thank you, Dr. Murphy, for answering all the questions. And thank you, everyone, for continuing to submit questions. We look forward to answering more of them. We start today with a big announcement coming out last night that the Biden administration plans to recommend an additional COVID dose for everyone after 8 months. What is your reaction, Dr. Murphy?
Well, I was just a little bit surprised at the timing. I think just 2 days ago, they did approve to get a third dose for people who are immunocompromised. So that was because those people have difficulty mounting a good response in the first place. So it's not really a booster. It's really just a third shot to help with their immune system. And there have been several studies that have shown in those patients that have this very suboptimal response, that if you give a third shot, they get a much better response. They may even need a fourth shot. That remains to be seen. What President Biden announced last night is that everybody who's been vaccinated 8 months or longer, so the group that started getting it in December and January, should be also eligible to receive a booster. So that's technically a booster. You're already immunized, but you need a booster. They must have some information on the waning immunity and the number of people in the hospital now who've received the vaccine. So these breakthrough infections must be increasing enough to get them concerned, along with the waning antibody titers and other tests that they have. So that's good news. They're going to match that up supposedly with the full vaccine approval that is expected any week now, from Pfizer anyway, and Moderna will follow, and Johnson & Johnson after that. But then those booster shots will start coming. And remember, at the beginning of this thing, it was difficult to get a vaccine. And the groups that got the vaccine were the nursing home residents and elderly people and healthcare workers. So those are the ones that are out 8 months. So you'll see the 8 months will come up just the way the vaccine rolled out.
Mm-hmm. And you touched on the difference between a booster and an additional dose. But speaking on the approval or the recommendation of additional doses for those who are immunocompromised, do you know who specifically can get those? And if you got J&J initially, can you get those mRNA additional doses?
Yeah. So basically, they have defined it somewhat loosely. So they don't want to make it a checklist type thing. They do want the patient's physician to be able to have a little leeway, but it's people with severe immunocompromised status. So people who have had an organ transplant, a kidney transplant, for example, and they're taking drugs to suppress the immune system so that they can keep that organ. So there's the transplant patients, there's people that are on steroids, there's people with cancers who are receiving chemotherapy who are immunocompromised. There's all sorts of congenital disorders associated with the poor immune response. They estimate it's about 3% of the population actually may have some immune suppressive condition and that they should take an extra dose. So if there's any questions, you can just really bring it up with your physician. And then if there's some back and forth, just wait a couple months, just wait another month and it's going to be available for everybody.
Right, that's great news. And what can you tell us about the Chicago Public Schools vaccine updates?
Yeah, so they have mandated, it's really just going one by one group by group by group by group, mandating vaccines. Many of the hospital systems, another one, I think North Shore system, also is mandating all employees to get vaccinated. The Chicago Public School system is doing the same thing. Some of the big companies have started to do it. And, they essentially, they want the workplace to be safe. And, and if you're not willing to get vaccinated, they're not willing to have you come back to work.
Mm-hmm. And speaking about vaccine requirements, just recently, Canada announced that they will require vaccine proof for air travel. Do you expect to see something similar in the US?
Well, for Canada, it's actually even more than air travel. It's ship travel, train travel. It's all travel coming into Canada. Other countries are going to be doing the same. It's always been more difficult traveling with internationally with proof of vaccine or proof of a negative test or whatever. So you're going to see more and more of that. Whether the United States does it, I mean, I would think they would. I mean, who wants people coming in here that are going to add to the unvaccinated crowd and spread this around? So I would imagine it's just a matter of time before the same thing happens here.
Mm-hmm. Now we're going to switch over to some of our viewer questions for the week. Our first one comes from an 84-year-old viewer who in the past 15 years has had a bovine valve installed and just recently had a pacemaker installed. They've also had several anaphylactic reactions to medication and are worried about the potential of having another allergic reaction, and they are wondering what your advice is on receiving an mRNA vaccine.
Yeah. So there's actually been a lot of work looking at patients like this. You always have a risk-benefit ratio. Remember, nobody's died of anaphylaxis yet that we know of from these vaccines. Definitely an 84-year-old with the pacemaker and all the other problems that this person has, if they get COVID, their risk of dying is substantial. So with that as a risk of not getting vaccinated, to get vaccinated, the risk of the anaphylactic reaction, you know, it's real, but you can have that vaccine in a hospital, which I would highly recommend. I wouldn't go to a pharmacy or some clinic. Just make sure that you have the vaccine at a hospital where if you do have a bad reaction, you can be appropriately treated. So, you know, it's always a risk benefit one way or the other. I think it's definitely better to take one of the mRNA vaccines.
Okay. Another viewer's parent has had 2 kidney transplants. The second one was in 2015. And at that time, the parent had also suffered 2 strokes and had a double bypass surgery, and now has onset diabetes from their kidney medication. There has been some back and forth within the family about vaccination. Some are vaccinated in the family, some are not. Should their parent get vaccinated, and what risks come with that vaccination?
Again, it's really kind of the same answer. This person gets COVID, you know, it could be really bad. They could become incredibly sick, maybe end up in the ICU, maybe even dying from their underlying diseases because of the stress of COVID. So, you know, this type of person actually is eligible even for the 3rd shot because of the kidney transplant status. So they should get the standard doses and then wait probably several months and have a 3rd dose as well. I mean, that would be the best thing. Mm-hmm. And everybody around that person should be vaccinated because, you know, they can bring it to that person and give it to them. And, you know, the consequences could be quite severe.
Another viewer is fully vaccinated and their parent is in a nursing home, and the parent has also been fully vaccinated and actually had COVID in the past. Mm-hmm. But recently, one of the nurses at the nursing home tested positive and all visits have been suspended for 2 weeks. And the viewer was wondering why visits have been suspended even for fully vaccinated guests.
That's because of the Delta variant. So the Delta variant virus, which now accounts for 93% of all the infections in the United States, is so hyper contagious that even people who've been vaccinated can transmit it, can get it and transmit it to others. And that's why they put this restriction in when that nurse tested positive. It's just the changing nature of the virus. Several months ago, when Delta was not a big problem, they wouldn't have done what they're doing now. But things have changed. So we really have to be on top of our game with this pandemic.
Mm-hmm. That's, yeah, very true. And when do you think vaccines will be available for children aged 6 months to 4 years?
Yeah. So, well, the first group is like age 4 or 5 to 11. That's the one that's going to get approved next. Then the 6 month to 4 or 5 years will be after that, because that study started later. You know, they're doing the study, you know, age getting younger and younger and younger. And so, I mean, I heard an estimate that maybe that 6 months to 4 years vaccine could be approved by the end of 2021.
Possible. And yeah, and why are children now having increased COVID cases and even more symptoms when earlier in the pandemic we weren't really seeing children affected as much?
Yeah, it's probably due to the Delta variant. It's so transmissible, and it is a slightly worse disease. So, you know, more kids are in the hospital now than ever. And compared to influenza, the flu, where it's mostly kids under 5, with coronavirus, it's kids of really all ages. So under 5, 5 to 11, and 11 to 18. So it's really all ages. Now, it's not a real dramatic number, but it does appear to be going up, and there are anecdotal reports from some of these poorly vaccinated states saying that, you know, they have never seen this many kids in the hospital with COVID.
Mm-hmm. It's really, really tragic.
Yeah.
Our final question, also about kids, is since most elementary school children are not yet eligible to be vaccinated, are masks and social distancing enough to prevent them from getting COVID?
Well, it's better than nothing. Let's put it that way. The regular little blue surgical masks are at least 40% effective. The N95 or KN95 are much more, but they're very difficult to wear for long periods of time. I think it would be really too difficult for a school. So the surgical masks actually work better than the cloth masks, because every cloth mask is manufactured a little differently. The more layers, the better. But I think those little blue surgical masks are actually probably the best. It's better than doing nothing. If you do nothing, you know, the thing is just going to spread like crazy.
Mm-hmm. Well, thank you so much, Dr. Murphy, for your time. And thank you so much to all of our viewers for watching and submitting questions. We really appreciate it. Thank you so much.
Thanks, Katie.